you. Hi, everybody. Welcome to this episode. Today, I'm Deanna Marr. I'm the owner of Restorative Solutions. I'm an outpatient occupational therapy practice in the Tampa Bay area. And I am joined by an OT friend of mine, and she has a new business out. And we're going to talk about something that, as much as pelvic floor for women and men are not talked about, today we're going to talk about pelvic floor therapy for kids and teens and what every parent should know. So I want to welcome Marina. Please tell everybody who you are, what you do.
First off, thanks for having me. I'm Marina Berube. I'm the owner of Core Start Pediatrics. We are a pediatric pelvic health practice. We do in-home and telehealth visits throughout Florida, in-home in the Tampa Bay area.
Cool. I didn't know that you were doing telehealth too, so that's cool that you're able to reach people even, outside of the areas. So,
Initially, I was just going to do around the Tampa Bay area, and then I saw the need for it throughout Florida. There's very little pediatric pelvic health therapist, OT, and PT in the Florida region.
mhm.
Actually, pretty much throughout the United States, we're kind of very slim and hard to find.
Yeah, I think, like I said, as much as there's not a whole lot of people out there doing pelvic floor for adults, there's even fewer. I know one PT here in the area, and my mentorship that I'm a part of for pelvic floor, they are doing pelvic floor pediatric at their clinic in Arizona. So, like, other than that, like, I really don't know out there.
Uh-huh. There's Kiara Smith, and she's in California. She's actually outside of like the general pelvic floor courses that I've taken. She has a specific one for pediatric, and I believe I could be wrong. There could be someone before her, but I think she's kind of the pioneer for
Okay.
OTs, anyways, in the pediatric health.
That's cool.
Yeah.
Well, I see, so my practice, I see like kids all the way up to adults. So I'm kind of like a unicorn out there because there's not very many OTs, especially in private practice, that work with adults, but and see kids. Usually it's like, when you think of OT, you think of pediatrics. And
Mm-hmm.
but with I work with adults with disabilities and stuff, and a lot of the people that we get, we're working on toileting or hygiene with our adults with disabilities, especially like if they're on the autism spectrum. So I think this is a great topic to talk about today. Hopefully, I can learn something as well, and I can bring to my clients that I have. So let's see. Oh, today we are going to talk about something many parents don't know exists, and it's the pelvic floor therapy for kids or even teens. Um, if you've ever struggled with potty training, had a child who wets the bed, or dealt with constant constipation, this conversation is going to be for you. So, and I was just thinking too that a lot of even older kids, and I didn't realize this until I was taking some of my pelvic floor courses, that even teens, like, especially if they're in competitive like gymnastics or cheerleading, things like that, they or runners, even the teenagers, they can develop pelvic floor dysfunction and have problems with leakage or pain, even at that age, and they bring it on into adulthood. And now if we have more awareness around it for parents or even physicians, maybe we can help these, people earlier. So I think that's a good thing. Um, so maybe I'll let you, first question, be let's just break it down simply, especially for parents, like so they know when we're talking about the pelvic floor, what is the pelvic floor and what does it do?
So pelvic floor, what I do, especially because we're working with children, so I like to kind of bring it to their level. So I think of the pelvic floor as a group of muscles that are kind of hammock like at the bottom of your torso, in that area in between your legs. that provides support to your internal organs, as well as provide either the ability to let fluids, urine, or bowel movements out or hold them in.
So, and why are these muscles like important for both bowel and bladder function or control?
Because they do provide support. So, first off, they're providing support to your bowel, your rectum. So, if they become loose, you can get prolapse, you can get different issues with that that can open up the whole stem of things if they become lax or stretched out. And also, they provide support so you can keep things in when you don't want them to come out. When you don't want urine to come out, like for instance, when we do have our pediatric athletes, you want to be able to hold that in while you're doing different exercises, different sports, as well as that running. I know running comes with, you're a runner as well, it comes with different issues of, especially longer runs. We have a lot of people that I know my marathon run. I've never actually done a marathon at this point. I think you just did, didn't you?
I run, but not that far.
Oh, okay. I thought you did just do a marathon. But I know some of my marathon friends, they do wear briefs and stuff because on these long runs, they oftentimes do have bowel movements. So teaching them your pelvic floor muscles, how to coordinate them with your breathing, how to coordinate them with your steps, your movements, so all that kind of why they're important.
Hmm. So, what do you think an OT brings to this space? The pelvic floor or even pediatric pelvic floor.
Yeah. So I think we have a lot of knowledge and wealth of knowledge that we can bring to this area. First off, we look at the body holistically. So we can look at breathing, coordination. If they're having sensory issues that are causing these impairments, we can look at that. Um, we have the knowledge with diet. We have the knowledge with the muscle skeletal system. So it's kind of all encompassing where we can look at one person can come in and we're not just looking at the muscle skeletal system or their movements. We're looking at it holistically. Okay, they may have impairments with that, but they may also have impairments with other systems as well that are bringing it into it. And we have background knowledge in pretty much the whole body, touching on everything.
Yeah, I think OT, is because of our background, some of that, like mental health background, helps with our what we bring to the table in our treatment sessions and how we can, relate to people, or we look and work more holistically and like dig down like it's the whole like introception piece. Like I'll tell you, I know that I'm a little older than you. So, like, when I went to school and stuff, I don't even think that that was like on the table. Like, I didn't learn that till maybe 10 years ago, when I was like taking more courses to help my daughter and figure out what was going on with her because she was having so many like challenges in school and stuff, and just body awareness and like knowing like when I need to go to the bathroom or what this feels like. And some kids might, um especially if they're having sensory or conditions or other things going on, they have a upregulated nervous system or something, they don't really understand what they're feeling or can process it right. And so being able to like hone in on that is important. And I think that OTs, we are built, uh, to be able to do that. So, let's see. Um, so when you're talking about like children and pelvic floor therapy, like what kind of things should parents or physicians or even other therapists, what are some of the common concerns or complaints that parents might be having that is something that pelvic floor for kids you would address?
So I would say probably bedwetting and daytime wetting is probably up there on one of the top ones that their concerns are, as well as potty training, because a lot of the parents were, both parents are working nowadays. Daycares are pushing. You need to have your kid potty trained by the time they start. So we're starting potty training earlier when not necessarily the kid is appropriate for potty training at that time. So that's becoming a concern that parents are having, that can OT can deal with. Constipation, chronic constipation, UTI, withholding, sensory issues that are causing impairments with toilet training, or they're doing good with toileting, but then there's something comes up where they stop toileting on the or going on the toilet where they prefer going in briefs, or pull-ups, whatever they're in. So stool accidents, there's a whole list of things that we can work on. But I would say the top two are probably the daytime and the nighttime.
I had a little kid, she was about 5 a couple of years ago to come to the clinic, and the mom was concerned because she didn't really have any problems with toileting when they were inside the house, but it was when they went out of the house to the mall or to like Disney, and then she would not go to the bathroom because she was terrified of the hand blow dryers, and she couldn't, it was terrifying for her. So, like, how, and I'm not trying to really put you on the spot, but so how would an OT, like, because that is part of toilet, because somebody could like shut down and get fearful, that could like go on to other areas of their life. So how
Yeah.
would an OT, like, needing to work with this child, like, how or what's the process that OT would bring in, it just, a little bit briefly, um, to help this child be able to go to the bathroom like in public places?
Yeah. So first off, we would start just getting them used to going into that bathroom space. So going into public bathrooms, if that's the concern of the parents, they're doing fine at home. So obviously, we know it's not a holistic bathroom situation in these public bathrooms. And I actually do see that a lot, whether it's the automatic hand dryers or the automatic toilets, because they also make that loud sound too that you can't control. So to start, it's just getting the kids used to going into the bathroom. So a lot of OT, as you know, is through play. So doing scavenger hunts, we can just, so they're thinking of it as a play versus I'm going into the scary environment. So it's more of a fun thing for them to do. So have a scavenger hunt or they're looking for different things and you place some in the bathroom. So to start, maybe you would just place a sticky note on the bathroom, and that's like a number 12 that they're going to find. So they found 1 through 11 outside of the bathroom, and the number 12 is just on the toilet or just on the door. So we have to go to the inside the door, take the number off. So getting that initial exposure and then slowly building up their confidence to just go into the bathroom. So then the next time you do it, say it's one of the numbers that they're looking for is on the sink. They go in there, take that. So you're slowly building up that confidence. And then, so now they're used to, okay, this environment isn't scary. So now we're going to start working with just hand washing. And then mom can bring in a towel. We can just dry our hands. So we're getting used to that environment little by little. Next time we go in, let's hand wash. And we're just going to do the dryer, but for a second, we're going to put our hands under it, and then mom can dry our hands with the towel. So we're slowly building up that exposure. You can also have them, without even washing their hands, have them stand next to mom, and she puts her hands into there. So we're both doing it, play games with it. So it's just different things, getting that exposure, but not initially throwing them right into it.
Mhm. I can see where, like, being able to go out in the community with your clients and stuff is really like valuable,
Yeah.
and how your business is set up
Yeah.
so that you can go and do it in that area, because if you're not practicing it in that environment, how are you going to make progress like toward it? Because I don't have a manual hair like hand dryer here at the
Yeah.
house, or not, and not even at my clinic. So it's like, yeah, so that's great that you're able to go into that environment. um and the one thing I feel like, um because I always talk about normalizing. If you see me on my socials, I'm always like normalizing, like um, peeing your pants as your age is not normal, right? So I have this written down here that so many parents think that their child is lazy or misbehaving, but it could be muscle or sensory based issues. Like nobody wants to have accidents. I mean, there's something, underlying that's causing that.
Yeah. Yeah, I mean, when you think about it, especially in the public bathrooms, but even our bathrooms at home, especially our kids with these sensory impairment issues, they they go in and they hear the buzzing of the light that we can drown out. We don't notice that, but they hear that. They also notice the brightness of the light. Our bathroom at home may not be as bright as a bathroom in public because they're using those bright fluorescent lights. So you have to think about that. So that's two sensory things that the kids are being hit right then. So obviously it's gonna be scary. It's gonna be cold in public bathrooms. Sometimes in your home bathroom you can control that a little more, but especially in these public bathrooms you can't control temperature. Then you sit on the toilet, that's gonna be cold. So there's another sense that these kids are just being bombarded with so many scents, like the different senses are being hit. And if
Mhm.
they can kind of cross those out and be like, okay, I'm just here for the toilet and I'm leaving, they're going to shut down. And that's when we see these things. And that's when we see, oh, they're having behaviors. No, they're not having behaviors like you said before. They just don't know how to interpret all these senses that are being hit at once. And then you expect them to go to the bathroom on top of it.
Mhm. I like how you like broke that down because even as a therapist that has had a child with some challenges, and even working with the different age groups that I've worked with, sometimes we don't always think about
Yeah.
that what the other person is like dealing with,
Mm-hmm.
internally and how they're processing
Yeah.
something. And sometimes I get overwhelmed and anxious. I used to fret a lot anywhere we would go. Like I'm like doing something with my hands, and my family would like tell me to stop. But I was, you know, overwhelmed. My nervous system was very like, um, just couldn't take,
Yeah.
what we were doing. And we don't think about like kids and stuff too, like their nervous system, and learning how to cope and maybe have some of those deregulation type techniques that they can use to calm themselves and prepare to go,
Mm-hmm.
into that environment. Even though we're kids, they're kids or adults. Like some of these things might help, adults too. That sometimes we got to do a lot of nervous system work, right? To just get us acclimated to whatever we need to do, because I know for some adult pelvic floor client, we start there. We start with breathing a lot. We start with nervous system work to help them with their problems. So you know we'll do that with kids that are might have challenges or even maybe not have challenges, but their nervous system, they're like upregulated for whatever reason.
Mm-hmm. Yeah. So you have to start kind of at that foundational.
So what does pediatric pelvic floor therapy kind of look? I know you explained it a little bit earlier, but like, what does I don't want to say traditional, but what does like a session might look like when you come in to
Okay.
work with a kid?
So with children, we're not going to do any invasive, any internal exams or anything, especially sometimes with the older population, if you do get a teenager, as long as they've had an internal from a gynecologist, then you can do it. But I think my rule of thumb is start with other things first before you go into the invasive internal, even external in the genitalia area. Like look at the holistic person, see if there's other things that you can touch upon and work on before you go into that. So it's not invasive. It's often, like I said before, playing. So you bring in a lot of games. You can do breath work with balloons. You can have them blow up a balloon to work on breath work. You can have them blow bubbles while on the toilet to work on breath work, or the windmill type of, I don't know what
Yeah,
it's called.
pinwheel or whatever that's
Pinwheel.
called.
Yeah, you can have them below those. So that's working on breath work. So, but in a child's eyes, this is just play. It's game. Um, have them play games, like I said, a scavenger hunt, just to get them used to going into the bathroom. So they're not actually doing anything toilet wise. They're just playing a game in their eyes. Movement. So a lot of different movement, bilateral movement, crawling on the ground. It just, I like to just bring in play. So the kids are used to it. They don't think it's anything scary. They don't think it's traditionally therapy. They just think that they're coming for fun. But in turn, we're working towards the end goal of getting on the toilet, fixing constipation. Also, working with constipation, we can look at bladder and bowel logs. We can work on um, food and fluid intake logs, so things like that. I often initially, like with the evaluation, I'll send that home with the parents, the bowel and bladder log, as well as a food log. So then we can look at that and see if there's any correlation between them.
I could see that a lot because having a daughter that, she's very much picky eater and stuff, and only certain things to eat or drink. And kids don't like move around a whole lot now, like, playground and like all this stuff, they sit around a lot more. So I imagine like um prevalence of constipation and stuff, especially with, different eating and stuff.
Uh-huh.
Now, do you find that you might have to do some like for like constipation management, you or teaching the parents to do any like um manual work on the abdomen or anything to help
Yeah,
them
so
with
it's
that?
like the abdomen massage to kind of move things along. So I'll teach them that as well as looking at obviously their fluid intake. That's a big thing, and their food intake because that can cause a lot of constipation. And a lot of parents initially, you bring up constipation and they're like, oh no, they go regularly, but really the child's only going twice a week, which isn't, that could be still constipation because they could have that blockage and little droplets of poop or whatever can be getting by for the parents thinking constipation. So that's why the log comes into play. And we can look at it and say, yes, no, maybe we should work on things here. Let's try it and then see if that increases. So if they go 3 times a week, 4 times a week.
Yeah, it's hard like with that. I was thinking about, because there's not in all the classes I've taken, there's not like an answer of how many times a day or a week is
Mm-hmm.
normal pooping.
Yeah.
But I know the Bristol stool log is a good indicator of constipation, but also like your breathing patterns and stuff on the toilet. If you're breath holding and really like, even for kids, if you're breath holding and bearing down a lot, then you're probably constipated.
Mm-hmm.
I didn't learn myself like I shouldn't be like breath holding and
Yeah.
bearing down until I had a hysterectomy. I was told if you do that, you'll rip your stitches and have to go to the hospital. So I had to learn. I learned very quickly that I can't, a proper, and that was before pelvic floor training that I had or therapy or anything. I learned like, oh, I got to breathe when I'm on the toilet. So,
Yeah.
maybe parents just like watching the behaviors of their kid like on the toilet when they're actually pooping too.
Mm-hmm. And which obviously constipation can lead to a whole other thing. So constipation, if it is painful, that may stop the kid from wanting to go onto the toilet. So that's one thing that we can address. Constipation is also linked to bedwetting. So that's like one of the number one linked things to bedwetting. So looking at that to stop the bedwetting.
So what would you say if you have your child's maybe older, or even a teen or preteen, and they're still struggling with issues with maybe bedwetting at night, or um, they're in their sports or whatever. Like, or basically they just are not doing a good job with um, being continent through the night. Like, what would you tell those parents?
Well, that it's not too late as long as they're reaching out for help and trying to get help, and they're not just going with the well, you'll grow out of it eventually. There's still avenues that we can look at. We look at what have you done already, and especially with the bedwetting, I'm big on like a holistic type of thing. So once again, going back to the food log and seeing, so I would have them write down like, would you eat breakfast, lunch, dinner at different times in between, and did you eat any bladder irritants or drink any bladder irritants before bed? Because that obviously can lead to bedwetting and constipation. So as long as the parents and the child are willing to try and are willing to work towards it, you're never too old. You know,
Mm,
and the same with the athletes. Like as long as they're willing to try, and maybe some routine changes, so you have to be willing. It needs to be important for you to care about it, for you to change. But as long as you're willing to try, then there's always hope.
I think that so, I'm not, I see kids, but I have never called myself a pediatric therapist and all. But I think the biggest thing, because I see it with adults, is the buy-in, right? Like you have to buy into anything. And I think, and when you're working with a kid, like they don't know, like if they need to buy in or not. It really
Yeah,
comes down to the parent and how the parent, and that's sometimes the biggest thing is because the parents at times don't want to be responsible or take on that role of being responsible for that change and what that might mean as far as routines, habits, or, what they eat or drink. And that's the biggest thing to see the best outcome is the buy-in
yeah,
from the clients. But with pediatric, the client is both a parent and
yeah,
the child a lot of times.
yeah. Uh-huh. And that's what I see some struggles with is because the parent comes to you and says, my child's bedwetting, say they're 17 years old. And so you give them some strategies, initial strategies. Well, I don't want to wake up. I don't want to ruin my sleep. I don't want to, they don't want to change the routine. So then you have to take a step back and look at, all right, what can we do before you go to sleep and try to find that avenue that will work for them? Because obviously, like you said, if they don't feel like it's going to work, if they're not buying into it, then you're not going to get anywhere. But if you can take a step back and look at what will they compromise with, what will they work with, and go.
So true. Okay. Um, we're almost done here. So, what is one thing every parent should know about pediatric pelvic floor therapy?
That you're not alone. I think there's, I think the statistics most recent that I read was, I think it was five. It was 5 to 7 million children are bedwetting at night. So first off with that, you're not alone. It is more prevalent than people talk about. Once again, it's kind of taboo. You don't want to share that. It's not something that we just talk about in normal conversation. Um, Also with toilet training, it's difficult. We are all children are different, so you can't compare your child to your coworker's child or your sister-in-law's child. So you're not alone. There is help as long as you're willing to find help. And there's a million other people like you that are dealing with things, and there's a community out there.
Yeah, the normalizing it and talking about peeing and pooping and whatever. I think like in general because like people don't, even adults, they don't want to and they don't come to pelvic floor therapy because they don't want to have to deal or talk about pee, poop, sex, whatever.
Yeah,
But if we get the information out there, we talk about it, tell people. So it's no like it's not taboo. We talk about it because we're therapists. Like, when I work, I worked in the nursing home and all at lunch, we're talking about peeing
Right.
and pooping and all, it's like more, but we're therapists, but the rest of the world, they don't,
Yeah.
but it's just to get people to like understand that, like, the more you know about your bodies and like how to help, it will help you like your whole life. Like things get better, if we are addressing, some of these things. So I want you to let us know, where can parents learn more or get support from you?
Right. So my Instagram and my Facebook are Core Start. So Instagram.com/Core Start and Facebook.com/Core Start. I also have a website. You can Google Core Start Pediatrics, and it's CoreStartPediatrics.com.
Nice. So, and I will have everything linked below as well. In case anybody has questions, they can reach out
Yeah.
to Marina. And I just want to thank you for agreeing to come on and talk about this. I think it would be great to do something again. Out there. But just for everybody to know about, like, pelvic floor is, this is a real range. Everybody has a pelvic floor, kids to older adults. And we're just here to help people, live the best life that they can. And you don't have to live with, leakage, constipation, um, pelvic pain. There are things that you can do about it, and there are professionals out there that are, here to help you. So, and I'm so glad that we have another, a pediatric pelvic floor therapist, and, get that word out there for people.
Yeah. You got to break this taboo, build confidence. I'll get there.
So, well, I appreciate you coming on today, and everybody, we will see you on the next one.
Yeah. Bye.
Let's see.